Hello, I'm Eric Shawn, and welcome to Sunday House Call.
And I'm Marthel Neville. Joining us is Dr. David Samadi, Chairman and Professor of Urology at Lenox Hill Hospital and Chief of Robotic Surgery.
And Dr. Marc Siegel, Professor of Medicine at NYU's Langone Medical Center, who is also the author of The Inner Pulse, Unlocking the Secret Code of Sickness and Health. Doctors,
great to see you.
As always, good to see you.
Thank you.
Had a good week.
Well, we are going to begin today with breast cancer. October is Breast Cancer Awareness Month. It is a disease that touches more than 200,000 families each year. And Dr. Samadi, I want to start with you, and if you could tell us some of the latest breakthroughs in the research and testing of breast cancer.
Marcel, this is a very important month because October, the whole world turns pink, and congratulations for wearing the right color. 230,000 women get breast cancer, and 30,000 still die from this disease. Now, we have made a huge progress. If you look at the 5-year survival for breast cancer in this country, today is about 90% at 5 years. In 1970s, it was only 75%. Why is this happening? And it keeps going back to early screening. And I just interviewed a lady this morning on my radio show, said, look, 20 years ago, I took it into my decision to go ahead and get my mammogram, and I'm standing today cancer-free. So screening plays a big role, and of course women are very aggressive when it comes to this. But also we have Angelina Jolie's factor. There's a study that just came out that 20% increase in awareness as a result of what she did, getting to know what your BRCA1 genetic tests are. And the big message is that if you're under the age of 50, know, and you have family history and you've had history of ovarian cancer, get that test.
Do you have to request that test? It's not automatic given, is it?
It's not automatic, and also there's a lot of guidelines. That's an excellent question. A lot of guidelines is coming to the doctors, and they may or may not recommend this. But so you should be in charge of your health and say, look, I want to know what my genetic tests are. I know what my BRCA1 is. You know why? Because if you're positive for that, you have very high risk of breast cancer. You have 80% chance of ovarian cancer. And what she did and went public and talked about this is extremely important. But also another factor that's very important to both of you that people need to know this is that we are becoming smarter. We're using our genetic testing like Oncotype DX to find out, 21 genetic tests to find out whether somebody needs chemotherapy or not. And in this, based on this study, 10,000 women looked at this genetic test. 16% of them did not need any chemotherapy. That's huge. So we're selecting the right people. We're doing the right procedure, know what your risk factors are, and the awareness this month is very helpful.
So, Mark, what should women do? How often should you get tested, and also their self-examination?
Absolutely.
Well, okay, first of all, I get this question every day because there's a lot of conflicting information out there on this. And I agree with David that earlier is better. And here's another statistic to throw at you. Mammograms are 90% effective at diagnosing breast cancer early. Here's another thing. Between the ages of 45 and 55, the #1 cause of death in the United States for women is breast cancer. So I say start getting your mammograms at the age of 40, especially if you have a family history.
I know someone who has breast cancer, in serious aggressive breast cancer at early 30s.
That can happen. So, again, David's point, you have to know what the family history is. We're getting better.
Family history.
Well, we're getting better and better at finding out genetic predispositions. Also, careful breast exam. Now, breast exam misses a lot. I'm not going to say breast exam instead of mammogram. Here's another thing, Arthel. When you're younger, you have more dense breasts, right? So the mammogram may not be the answer. You may need to use an ultrasound or an MRI, something that will look at the breast tissue if it seems slightly abnormal. All gynecologists and all internists out there should be paying attention to the point you just made, that sometimes it can be even earlier than 40. We want to get this early before it escapes the breast, because then limited procedures can be done, lumpectomies. Now, reconstruction on the breast has made great advances, so your breast can look and feel the way they did before. And one more thing. About if you, God forbid, have breast cancer that escapes the breast, research now is looking at what mutations are occurring, why your breast cancer isn't responding to the chemotherapy or treatment. What else can we offer you? There are vaccines coming out now. There's immunotherapy. There's things that look at the DNA of the cell of the breast cancer and say, this is abnormal. What can we do to target it?
So first of all, because you have younger women and celebrities, as you pointed out, Dr. Marc or Dr. David, I'm not sure which one, but when we talk about this, and there's no longer, which should not have been, that stigma of having reconstruction surgery if needed after breast cancer. We're talking about it. That in of itself is great. Clearly, there's better research, but why isn't there a cure yet?
Look, I think the research is ongoing and we're getting better and better. And the answer to your question is that, we learned that the breasts are not what make women feminine. If this thing is going to spread and it's going to really jeopardize your life, you will go on, and Angelina Jolie is going to go on and be still beautiful. But the big message is that if you catch it early, yes, it's a very radical procedure, but she's standing free, and that's high-risk genetic mutation is extremely important. We're also finding out that if you have, for example, estrogen-positive receptors, and for some reason tamoxifen or other medications may or may not work, now we have other medications that can work. And finally, going back to what Marc just mentioned, there are three-dimensional mammograms. There are breast tissues that are very dense and they're fibrous and have more glands. Those are at higher risk. So individualized care, precision medicine, these are the tailored screening are very important.
How does a woman know if she has dense breasts, and what do? You
Well, you're a
also,
gynecologist,
Marc,
should be able to tell you that,
Dr.
Eric.
Marc,
It's a great question.
Throw this in there to his question, because what if your breasts, what do you say, have cysts normally?
And that's also related to
Glandular cysts.
coffee drinking, by the way. If you drink a lot of coffee out there, you may develop cystic breasts as a result. If I examine a woman's breast and I feel irregularities, those are likely to be cysts. That makes it harder to interpret a mammogram, but you know what?
Or self-examination.
But you know what? Sequential mammograms, and this is another reason I'm all for early screening, whether we're talking about screening the prostate, whether they're screening the breast. Early screening is important because then we have something to follow. I look at last year's mammogram and I compare it to this year's mammogram. Has there been a change?
So each 1 year, every 1 year, or every 5 years?
Well, it depends on the patient. I can't give a prescription on the air here, but look, 1 year in a lot of patients. Some patients every year and a half. One more point I want to make. Early detection leads to less side effects, whatever your treatment is. I like to talk about quality of life because scientists are always saying the death rate is the same. Death rates are only one thing, Arthel. What about quality of life? If I have to put you on chemo, if I have to put you on radiation, it's not the same thing as a surgical cure.
And wait, the dense breast issue, can you just address that? You should have more tests?
You should get a lot of women that are listening and they're saying, guys, come on, what are we talking about? It's an annual mammogram. That's what they're saying right now. So get tested, and it's good to know. Now, not should everybody go out and start doing mastectomy? Of course not. But while we're on the topic, let me just mention also that alcohol consumption increases the risk of breast cancer. Overweight can change your hormones. That's very important. Cigarette smoking, please, if you're not smoking, don't start. These are all risk factors for breast cancer that you should avoid, and that's really, really important. And
to emphasize, Eric, those are hugely important points. And lifestyle and exercise key. To emphasize your point, Eric, the denser the breast, the harder it is to make a determination. And in younger women, you're going to probably have to use ultrasounds rather than mammograms, or a special kind of mammogram, as David mentioned, that's three-dimensional. It's more of a challenge, but we're up to it.
Big lesson also to a lot of men out there, because these two diseases, prostate cancer and breast cancer, are identical. Women, we salute them. They're doing a great job. Men out there do the same exact thing. Go get tested. Both diseases are identical stats, identical rate of diagnosis, and well, we all join.
Great
and certainly starting with Pink. Sunday Housecall is going Pink as other programs.
Pink for breast cancer. And there's breast cancer in men, too, by the way.
Absolutely.
That's true. Doctors, thank you.